All right, so we'll now proceed to the foot. But before we get to the foot, there's a region in between the leg and the foot, which is the ankle region, right? So in your ankle region, we have what we call retinacula. For example, these two here. We have retinacula, which are extensions of deep fascia. These retinacula, they work to tether the tendons down so they are not that mobile. Right. So remember, anterior leg had extensor muscles. So the retinacula that you find on the anterior leg, the two of them, they are extensor, retinacula. On the lateral side, we had peroneal muscles, which we also called fibularis muscles. So you will have peroneal retinacula on the lateral side as well. So you will have superior and inferior peroneal retinacula as well. Then when we go to the posterior leg, remember there are flexor muscles in the posterior leg. So the retinacula in that region will be flexor retinacula. Right. So there are mnemonics that work to tell you the arrangement of structures. So I'm using my left. Let me change so that I can write properly. So the mnemonic for arrangement of structures below the extensor retinaculum is the Himalayas. Are not dry. My handwriting is bad. Don't worry about it. Are not dry plateaus. This is from medial going to lateral as structures pass below the extensor retinaculum. This is the superior extensor retinaculum, the one that I've put in an X. Then this one that looks like a Y, that's your inferior extensor retinaculum. Right. So arrangement of these structures as they pass below it. From medial, the means a muscle that starts with T. So just remember which muscle started with T on the anterior leg. It was tibialis anterior. So I think you can see tibialis anterior. Let me use a different color. Let me use red. This is tibialis anterior. It's the most medial. Himalayas, we are thinking about a muscle that had hallucis in it. Right. So we have a muscle called extensor hallucis, which is this one. Right. So the Himalayas are, the A is an artery. So the artery from the anterior leg, we called it anterior tibial artery. As it goes to the dorsum of the foot, it changes name to become dorsalis pedis. Right. Dorsalis means dorsum of the foot, which is the top of the foot. Pedis means foot. Right. Note the N, it's a nerve. So the nerve from the anterior leg was the deep peroneal nerve. So remember, when we're doing leg, I say that the deep and the superficial peroneal nerve, they are so named deep and superficial in relation to what they do at the ankle. So at the ankle, the deep peroneal nerve passes deep to this retinacula versus the superficial peroneal nerve, which passes superficial. Right, so superficial peroneal nerve was for the lateral compartment of the leg. It passes superficial to the extensor retinaculum. I'll show you shortly where it will be going. Deep peroneal nerve passes deep to go onto the dorsum of the foot. I'll also show you shortly where it will be going. Right. Then dry, it's digitorum. So we have extensor, digitorum here. Right. Dry plateaus, the P there. Remember, there was a muscle that starts with a P on the anterior leg, which was the peroneus tertius. Right. So that's arrangement of structures below the extensor retinaculum. The Himalayas are not dry plateaus from medial to lateral. When I do the posterior leg, I'll show you that there's only a slight change. The hallucis and the digitorum, they switch when we go to the flexor retinaculum at the back. So I'll give you a new mnemonic, which will read that doctors are not hunters. Right? But we'll get there. Right. All right. So this here is the dorsum of the foot. This picture here, that's the dorsum of the foot. I think you can appreciate that there is thin skin versus the sole of the foot where the skin is thick. Right. So this is thin skin, it's mobile. Right. So it's thin skin that is mobile. And in terms of sensory innervation, there's a picture that I love showing. This one. In terms of sensory innervation, remember I showed you, or I was saying superficial and deep peroneal nerve, they are passing on to the dorsum of the foot. Superficial peroneal nerve, also called superficial fibular nerve, innervates the greater part of the top of the dorsum of the foot, except this cleft here, the cleft between the big toe and the second toe. So cleft between big toe and second toe is innervated by the deep peroneal nerve. So deep peroneal nerve will innervate muscles of the anterior leg. Having done that, it passes below the extensor retinaculum to go onto the dorsum of the foot. On the dorsum of the foot, it will innervate a muscle that I'll show you shortly, and also innervate the skin in the cleft between the big toe and the second toe. The foot and the hand are the same. So the same concept in the hand, where you'd say that nerves on the palm of the hand, they extend to innervate the nail beds. It will be the same on the foot. The nerves that innervate the skin on the plantar aspect of the foot are the ones that innervate your nail bed. Then this one will be a bonus to know that the lateral margin of the foot is innervated by the sural nerve. The medial margin, though not shown here, is innervated by the saphenous nerve. So just remember, saphenous is medial, sural is lateral. Right. The saphenous nerve is the one that travels with a vein called the great saphenous vein. The sural nerve travels with a short saphenous vein. Short saphenous vein and great saphenous vein should remind you of cephalic vein and basilic vein in the upper limb. So those two veins, they're also formed from a dorsal venous arc. Great saphenous vein is formed on the medial. Short saphenous vein is formed on the lateral. Same way that I had in the hand, basilic vein formed on the medial, cephalic vein formed on the lateral. Right. Okay. Then this is the anterior tibial artery here. Right. And remember I said anterior tibial artery, once it passes into the foot, it becomes the dorsalis pedis. Right. So there is a reason why people generally learn lower limb after upper limb. And the reason is they're almost similar. So if you know the course of the radial artery in the hand, then you know the course of the dorsalis pedis in the foot. Because remember, radial artery, it passes in the anatomic nerve box, passes between the two heads of the first dorsal interosseous, then it passes between the two heads of the adductor pollicis, then it arcs to form an arc, which was your deep palmar arc in the hand. Dorsalis pedis would do the same. It will pass between, it's not really clear on this diagram, so I don't want to say things you won't see, but yeah, this is your dorsalis pedis. This is your first dorsal interosseous there. So dorsalis pedis will pass between the two heads of the first dorsal interosseous. Then it will pass between the two heads of the adductor. This time around, it's a hallucis, adductor hallucis for the big toe. Then it curves to complete an arc that is on the plantar aspect of the foot, which we call the plantar arc. Unlike in the hand, where there is a superficial and a deep palmar arc, on the foot, there's only one plantar arc, which is completed by the dorsalis pedis. I'll show you when we do the plantar aspect of the foot, which artery actually forms it, right? Which is the lateral plantar artery. And that's your nerve, deep peroneal nerve. Nothing fancy about it. Okay. Maybe to pose a question to you guys, do you think we have a muscle on the dorsum of the foot? Hello? Guys, do you think we have a muscle on the dorsum of the foot? Guys, it's a yes/no question. I just want to know if you guys are here.
Yeah, Doctor. I think yes.
You think yes. Which muscles do you think are on the dorsum of the foot? You know,
The dorsum of the foot.
yeah.
The extensor digitorum brevis and the hallucis brevis.
Do you think there's a muscle called extensor hallucis brevis? Did you read that somewhere? Sorry? No, I didn't say that. I'm asking if you read that somewhere.
What did you say?
I'm asking if you read that somewhere. Normally, we just describe this muscle as the extensor digitorum brevis. No plus, no minus. But if you want to really analyze it, that extensor digitorum brevis, its most medial tendon, or part, this one, is what we call the extensor hallucis brevis. So in reality, extensor hallucis brevis is a part of the extensor digitorum brevis. Right. Okay. So do you get it that we have extensor digitorum brevis, but okay, maybe to make sense of things, the extensor digitorum longus inserts into the four small toes, but the extensor digitorum brevis inserts into the medial four toes, meaning the big toe and the three in the middle. The one that goes to insert into the big toe is what you call the extensor hallucis brevis. Then the rest of the tendons that go to the second, third, and fourth toes are what we call the extensor digitorum brevis. Right. Innervation of these muscles is just the nerve that was innervating muscles on the anterior leg, which was deep peroneal nerve. Right. Sometimes I'll just be asking to see if you really know what you're saying. Know that I'm doubting you. What type of skin do we have on the sole of the foot? I said this at the very beginning, guys. What type of skin do you have on the sole of the foot? This plantar aspect of the foot. Is it thick? Is it thin? Thick. So it's thick, which is the opposite of what you have on the dorsum, where there is thin skin. So it's thick, it's hairless, unless there's someone with hairs on the foot. Would love to see them. This is hairless, right? And it also has skin creases, just like on the palm of the hand. Right. There are a lot of sweat glands. Explains why some people get smelly feet. Right. And the skin is not freely mobile, like the skin on the dorsum of the hair of the foot. Does anyone know why the skin is not freely mobile? The answer is on your screen. Yes, what's this? Remember, the foot is the hand. So if you understood the hand, you should know the foot. The hand on the palm, there was a palmar aponeurosis. In the foot, there is a plantar aponeurosis. The only difference is that in the hand, the palmar aponeurosis goes to the 4 medial digits, these ones. It doesn't go to the big thumb. But in the foot, the plantar aponeurosis goes to all 5 toes. Shape is the same, they're both triangular. Right? What forms them? They're thickenings of deep fascia. Right? Okay. Why isn't this moving? So the nerve for the sole of the foot, there's a bit for what I want a diagram on innervation of skin. So the nerves for the plantar aspect, tibial nerve was the nerve for the posterior leg. Tibial nerve, when it reaches the ankle, it divides into medial plantar and lateral plantar nerve. Right. If you go back to the hand, I really love doing upper limb and lower limb at the same time. If you go back to the hand, innervation for skin on the hand, particularly the palm of the hand, the lateral 3.5 was the median nerve. The medial 1.5 was the ulnar nerve. Right? Then when we do lower limb, the first statement that I told you was the lower limb is just an upper limb that's rotated in the opposite direction. So what is medial in the upper limb? If you come to the lower limb, it's lateral. What is lateral in the upper limb? If you come to the lower limb, it's medial. So in terms of skin in the hand, the lateral 3.5 was innervated by the median nerve, right? Yet I'm saying for the sole of the foot, there is a lateral plantar and a medial plantar. So if lateral 3.5 was for the hand, for the foot, we are going to use the language medial 3.5, because lateral 3.5 was for median nerve. So for the foot, we'll say medial 3.5, which will be innervated by the medial plantar nerve. Then the medial 1.5 in the hand was ulnar nerve. So for the foot, it's now lateral 1.5, which is innervated by ulnar, no, not ulnar, but by lateral plantar nerve. Right. Going back to the hand had 20 muscles. The sole of the foot has 18. So the nerve in the hand that innervated most of the skin, which was median nerve, would innervate the least muscles, which were 5. Then the rest of the muscles would be innervated by the ulnar nerve, though it innervated, lead to skin. So it's the same in the sole of the foot. The nerve that innervates the greater part of the skin, which is the medial plantar nerve, innervates the fewest muscles. It innervates just 4. The nerve that innervates the smallest part of the skin, which is the lateral plantar nerve, will innervate the other 14 muscles. Right. So I think try as much as possible to have your things organized the way I'm saying them right now. You will never have a glitch later on if you want to give reference with this. Because instead of you claiming this and forgetting, you just keep the concepts with you. Right. So does anyone think that the sole of the foot has layers? The answer is in front of you. Does anyone think that the sole of the foot has layers? Or does anyone think there are no layers? Hmm? These are mnemonics I made in 2020, pre-COVID, I think. The fourth one, you can either say tip or pit. Whatever you remember better. So the sole of the foot is layered. So first layer it's alpha, second layer QL3, third layer FAF, fourth layer tip or pit. So not all these muscles are intrinsic to the foot. Some of them are actually going to be extrinsic. By extrinsic, we mean tendons of muscles that are coming from the posterior leg to enter the foot. Not only from the posterior leg, because remember when we did the lateral leg, I mentioned peroneus longus. And I remember telling you that peroneus longus, the tendon will cross the sole of the foot to go inset on the medial side. Same insertion as tibialis anterior, though the muscle is on the lateral side. So a muscle, if called intrinsic, it's a muscle in the foot. If it's extrinsic, for the case of the foot, there is a muscle on the leg, which is its tendon going to insert into the foot. So the first layer, alpha, the 2 A's on the outside, they're abductors. I think you can see this diagram here. There's this abductor, and there's this abductor. One for the big toe, one for the small toe. Right. Then the middle muscle is the flexor digitorum brevis, the F there. Right. Then the second layer, I hope you have copied that down so that I can. Okay. The second layer there, it's let me go to another diagram. The Q, it's quadratus plantar. This muscle here, quadratus plantar. The L are the lumbricals. So you also have lumbricals, just like in the hand. Then the 2 L's, remember I said it's QL3. The other 2 L's, these are longus tendons coming from the posterior leg. So you have flexor hallucis longus and flexor hallucis longus and flexor digitorum longus. And remember I said when we were doing the posterior leg, I told you that the flexor hallucis longus, it's supposed to end medial, but it starts lateral. Flexor digitorum longus starts medial, yet it wants to end lateral. So in the second layer of the foot, they cross each other there. Right. So they will cross each other. Right. Then your third layer, it's FAF. FAF in the sense that there is a flexor for the big toe, a flexor for the small toe, and these are brevis muscles. So flexor hallucis brevis, flexor digiti minimi brevis. I won't tell you guys origin and insertion of these muscles. We'll waste time, but most of them originate from the calcaneum. Then the A in the middle is now an adductor. This adductor, just like the adductor on the palm of the hand, it also has an oblique head and a transverse head. Right. Fourth layer, it's pit or tip. The T is the tibialis posterior tendon coming from the posterior leg. The I are the interrotial muscles. However, unlike the hand, where there are 8 interrotial muscles, the ones that we say ped and deb, 4 palmar, 4 dorsal. On the sole of the foot, there are only 7. So 3 plantar, 4 dorsal. Then T, I said, is tibialis posterior tendon. Then P, it's peroneus longus tendon. Right. Innervation for these muscles, I said, it's lateral plantar nerve and medial plantar nerve. And remember, I said there are 18 in total. Only 4 are for medial plantar nerve. So someone who's clever will only remember the 4 for medial plantar nerve. Then 4, then say the other ones are for lateral plantar nerve. The first exception, upper limb would say the first 2 lumbricals are for median nerve, then the other 2 lumbricals are for ulnar nerve. For the foot, it's only the first lumbrical that is innervated by the medial plantar nerve. The rest of the lumbricals, it's lateral plantar nerve. Right. Muscle number 2 innervated by medial plantar nerve, it's abductor hallucis. Muscle number 3, it's the flexor in that first layer, which is flexor digitorum. Muscle number 4 is in the third layer, which is your flexor hallucis brevis. Right. Then the rest of the muscles are lateral plantar nerve. If you want to be fancy or kudzikisa gejo, your lateral plantar nerve has a main trunk, then it divides into a superficial branch and a deep branch. So there are muscles innervated by the main trunk, for example, quadratus plantar. Then there are muscles innervated, so this is your lateral plantar nerve here. It divides into a deep branch there and a superficial branch there. So there are muscles innervated by the main trunk, then those from the superficial branch and those from the deep branch. Just remember that. Then this is your artery, the posterior tibial artery. It divides also into a smaller medial plantar artery and a larger lateral plantar artery. Right? The lateral plantar artery is the one that I said will form your plantar arc. So as it arcs, it's completed on the other side by the dorsalis pedis. The one that I said is on the dorsum of the foot. So I'm trying very much to simplify these things for you. Okay. So any questions on this? Then of course I know there are arcs in the foot. I haven't talked about them. I don't know if they're part of your syllabus, but they're more important for physio people. There are arcs in the foot. There is a lateral longitudinal arc, a medial longitudinal arc, and a transverse arc. These arcs are made up of bones. They are supported by ligaments and muscles and tendons, and they have what we call a keystone. Keystone is if any of you did physics, you know the keystone of a bridge, right? the highest point, the highest summit for support and stability. But I won't talk about axe right now. So do you guys have any questions on the foot? It's useless to claim origin and insertion for the muscles on the sole of the foot. But if you want them, I can tell you. Any questions?